Hey guys, this is Chapter 2, Workforce Safety and the Wellness of the EMT. Education Standards, Chapter Objectives, Key Terms. Alright, in this lesson, we're going to learn methods of safeguarding ourselves from stress, body substances, and other hazards. Alright, this includes emotional aspects of emergency care, scene safety, and wellness principles. Like always, we start with a case study. EMTs Connor and Melinda are approaching Unit 121 at Ashford Springs, an assisted living facility where they are dispatched for a report of a sick person. Are there any kind of particular issues that should be anticipated when responding to an assisted living facility? What hazards should the EMT be looking for in this situation? And what actions should they consider in anticipation of potential hazards? All right. The EMS provider safety is the most important thing on every call. That is your first priority. All right, you must be prepared to deal with the emotions of patients and their family members, and you must be concerned with your own physical and emotional wellness. Death and dying are inherent parts of emergency medical care. You must care for the dying patient's emotional needs and his injuries or illness. If the patient has suffered sudden death, you may also need to help the family or bystanders deal with the situation. All right, there's five emotional stages for death and dying. Go through denial, anger, bargaining, depression, and acceptance. All right. Dealing with the dying patient, family members, and bystanders, you have an obligation to help the patient and others. Each individual may be in their own respective stages. All right. Refer to your textbook, page 21. It lists several ways to reduce their emotional burden. All right, more case study. Connor and Melinda are met at the door by a young woman who's been crying. The woman says, "It's my grandfather. His name is James Bennett. He has heart failure and kidney failure, but he is a lot worse today. My mom called and said that he had a high fever and is disoriented." All right. How should Connor and Melinda interact with Mr. Bennett? Anything different they need to know anything different they need to do since he's disoriented? What can Connor and Melinda do or say to help comfort his family? What are the significance of knowing that the patient has a fever? All right, a fever indicates that the patient may have an infection, which would be more of an acute change in the patient's status. All right, possibly making this sudden deterioration of the patient's altered mental status. Okay. All right, emotional aspects of emergency care. We go through high stress situations. All right, we work long hours. We are bored between calls. I, however, am not bored between calls because there's always something to do. But whether it be get ready for class or Netflix and chill. We work too much. That's pretty much a guarantee. We get very little recognition, and we have to respond instantly. All right. You have to go from a dead sleep to being able to think and act and make sound decisions in very little time. High stress situations and stressors related to patient care. Making life and death decisions. Fearing serious errors. Being responsible for somebody's life. Abused and neglected pediatrics and geriatric patients. Caring for infants and children. Mass casualty incidents. And death or injury of a co-worker. Patients, families, and bystanders are not the only ones who experience extreme stress during an emergency situation. So do you. Accepting and understanding the fact is the first step in learning how to handle it in healthy ways. All right, you have three types of stress reactions. You have an acute stress reaction, delayed stress reactions, and cumulative stress reactions, also known as burnout. All right. General categories of stressful findings. All right. Your thinking may be off. You may be psychologically impaired. Physical changes, behavioral changes, and social changes. All right. You may have anxiety, guilt, loss of appetite, loss of interest in work, desires to be left alone, difficulty sleeping, or nightmares. All right. So how do we manage this? We manage this by avoiding self-medication. Don't turn to drugs or alcohol, okay? That's probably the worst thing you can do. And exercise often. We need to consider our diet and learn to relax, all right? And we also need to take measures to maintain a balance in your life. Don't work too much. That's kind of the pot calling the kettle black there, but I do have time off, and I will turn my phone off, and I will hang out with my friends. I will not think about work, about school, anything else. It's very few and far between, but and however, it does happen. Me and my group of friends, we do cruises, all right? So I can disconnect for 5 to 7 days at a time. Actually, something I'm looking forward to at Christmas. All right. We need to recognize the responses of family and friends, all right? They lack understanding. They fear separation. They have an inability to plan and frustrated desire to share. You need to help family and friends understand the nature of your work and what you do for patients. Talk to them. Describe how you feel about what you do. You can answer their questions, all right? Explain the safety precautions you and your coworkers take every day to ease their anxieties. And always include time with them on your list of priorities, all right? So, you can develop a buddy system with a coworker, all right? I have a buddy system. Suzanne, she's in the medic class right now. She is my partner. We have good days, we have bad days, all right? But that's always somebody, even when she's not there, I can call and vent to, all right? I have another guy that I work with. His name is Jim. He is my person that I call when I have a question about something. Hey, what do you think about this call? Do you think I should have done this differently? That's the person that I turn to for that. Encourage and support your coworkers. Resist the temptation to dwell on the negative. Take a break to exercise, or just take a break to Netflix and chill. Unplug, all right? Request shifts that allow for more relaxation. Yeah, good luck with that. And seek professional help if necessary. All right, critical incident stress management, all right? We are emergency personnel, and we can suffer from critical incident stress, all right? And we can develop many of the signs and symptoms of burnout. We may also suffer from repeated mental images of incidents, a fear of continuing our work in EMS, and an ability to function at a scene of a subsequent emergency. Critical incident stress management is a process to deal with stress encountered by the EMT. It consists of 2 different approaches to stress management: critical incident stress debriefing and critical incident diffusing. All right, a critical incident stress debriefing is ideally held within 24 to 72 hours of a critical incident. During this time, a team of peer counselors and mental health professionals help emergency providers work through the 7 phases, okay? All right, so diffusing is a version of the critical incident stress debriefing held up to 8 hours following a critical incident. It is attended by only those most directly involved in the critical incident and lasts only 30 to 45 minutes. It's much less structured than a critical incident stress debriefing or a meeting. It gives a smaller group of personnel an opportunity to vent their emotions and get information that they may need before the larger group meeting, okay? Going the wrong way here. All right. Symptoms of burnout can occur after exposure to a critical incident. Emergency personnel who suffer critical incident stress develop many of the signs and symptoms of burnout. This may also suffer from repeated images. I just went over this. Let's see. All right. Case study. Connor assures the family that he and Melinda are there to help and that they will let the family know what their findings are. The EMTs pull on disposable exam gloves as they ask about symptoms that may be related to infectious diseases against which they should take precautions. All right. What signs and symptoms may indicate that the patient has a communicable disease? Maybe that fever, he's got some sort of infection. All right, what factors should the EMTs take into consideration in deciding whether it is necessary to use standard precautions other than gloves? The environment they're in, it's rich for germs. As they approach the patient, are there other safety considerations that they need to be thinking about? All right, what exactly is scene safety? Keeping yourself safe at the scene of an illness or injury involves taking appropriate measures to protect yourself from infectious disease, following proper rescue procedures, and knowing how to handle violence, especially at a crime scene. It's also important to be an advocate for these protective measures to help keep fellow emergency medical personnel, as well as yourself, safe and well. Unless specifically trained and given the authority to do so, the EMT is never expected to act in any other capacity than a medical responder. Okay? As an EMT, you will often come into close contact with patients who are suffering from various diseases, and you will often work in contaminated environments. It's important to know how diseases spread and how to protect yourself from them. Pathogens spread in a number of ways, including blood and other body fluids, or through the air. Infectious diseases are contracted from pathogen transmission, but are not necessarily communicable. All right. You have different types of pathogens. You have bacteria, which is a single-celled organism that can reproduce. Usually responds to antibiotic therapy when needed. You have viruses. It requires a host to reproduce and invade cells in order to reproduce new viral particles. It is not responsive to antibiotics, and there are very few medications to treat a viral infection. Fungi are plant-like microorganisms, usually do not cause illness when the immune system is functioning properly, but can cause a problem in patients with immune deficiencies. Okay, this is patients, older patients, younger patients, kids, infants, HIV, those with pneumonia, stuff like that. Protozoa, single-celled organism capable of movement. It's often found in the soil. All right, it can give you some forms of gastroenteritis, some vaginal infections, and also malaria. Okay, helminths are parasitic worms, roundworm, flukes, tapeworms, hookworms. All right, these can get in your GI tract and lead to blood loss and anemia. All right, protecting yourself. Infectious diseases are contracted from pathogens. Some infectious diseases can be passed from person to person and are called communicable diseases. These diseases can spread directly or indirectly. All right, this is an open sore on a drug user. Okay, this has the potential to spread infection. Standard precautions. Guidelines were developed by OSHA to protect healthcare workers from communicable diseases. Employers must ensure that the standard precautions are available and must have a written exposure control plan. All right, the best way to protect yourself is not wearing gloves, but it is washing your hands when you take your gloves off. All right, to wash your hands, you want to wet them, lather them, scrub them, rinse them, and dry them. Okay? You should wash your hands even if you wear gloves. Please wash your hands when you take the gloves off. All right. Alcohol-based hand sanitizers can be used when you do not have access to soap and water. Okay. According to the CDC, you should use an alcohol-based hand sanitizer that contains at least 60% alcohol. Sanitizers don't eliminate all of the germs. Therefore, be sure to wash your hands thoroughly as soon as possible. Eye protection. This is something that we're seeing a lot right now with the COVID. All right, you can get COVID through droplets coming into contact with your eyes. Okay, always wear your gloves. Gowns and masks. This is another thing we're seeing with COVID right now. These gowns and these masks are incredibly uncomfortable. They are hot, especially in Louisiana in the height of summer. HEPA respirators and N95 respirators, still super hot, right? The HEPA and the N95 efficiently makes a barrier for things like COVID and TB, okay? All right, we're going to go over how to safely remove gloves. All right, don't put your bloody hands inside the glove, okay? Do not touch contaminated surfaces with your bare hands or fingers. Grip the underside of your non-dominant hand, all right, with your other glove, all right? Do not touch the inside of the glove. Use the glove finger to pull a cuff out and down on the other glove. Without touching the inside of the glove, continue pulling it down. Crumple the contaminated glove in the hand still wearing a contaminated glove, ensuring that it does not touch any clean surface. All right, take your uncontaminated fingers into the uncontaminated inside of the remaining glove cuff. All right, continue to roll the glove off your hand, being sure to clean your hand. Your clean hand touches only the clean inside surface of the second glove. Then you're going to put them in a biohazard receptacle. All right. Additional guidelines. Use disposable equipment. Wash soiled clothing and uniforms. All right. Document any exposures and bag infectious items. Use your sharps container. Clean up bloody or body fluids. Clean visible soil from non-horizontal walls. Always wash your hands. All right. So, cleaning, disinfecting, and sterilizing are all related terms. Cleaning is simply the process of washing a soiled object with soap and water. It is a mechanical process that uses only friction. Disinfecting includes cleaning it. It also involves the use of hospital-grade disinfectants or germicide to kill any of the microorganisms that may be present on the surface of the object. It is a chemical process. All right. Sterilization is the process by which an object is subjected to a chemical or physical substance, such as superheated steam, like in an autoclave, that kills all microorganisms on the surface of an object. All right. So, to protect yourself from diseases, we recommend immunizations for the flu yearly, tetanus every 10 years, Hep B, polio, rubella, measles, mumps, and the chicken pox or varicella. Okay, most of these you are going to get with your childhood immunizations. You may need a tetanus, a flu, and maybe a Hep B booster. Okay. All right, reporting exposures. State and local law vary regarding the reporting of exposure to blood and other body fluids, especially if a patient is known to be HIV positive, known to have Hep B, or known to be in a high-risk category for infection. In general, promptly report any suspected exposure to your supervisor, including date, time of exposure, type of body fluid involved, the amount of fluid, and details of the exposure. Always follow your local protocol and your service exposure policy. Okay? In your book, there should be a scene safety chart. All right? Please look over that. So, what is hepatitis? Hepatitis B and C are viral infections of the liver. It's contracted through body fluids and blood. Infected persons can be asymptomatic but still transmit the disease. All right, TB most often affects the lungs, but it can affect other tissue. All right, it's spread by breathing in the affected droplets of sputum of a patient with a cough. Some other signs and symptoms of TB include a fever, cough, coughing up blood, night sweats, weight loss. Okay. There are some antibiotic-resistant forms. All right, AIDS, acquired immune deficiency syndrome, results from infection with human immunodeficiency virus. It's more difficult to contract than hepatitis B through occupational exposure. It impairs the body's ability to fight infections. All right, it can be transmitted by sexual contact. All right, infected needles, infected blood or blood products. A mother can pass it on to a child. Contact between mucous membranes and open skin with infected body fluid. Some of the most common signs and symptoms are persistent low-grade fever, night sweats, swollen lymph nodes, loss of appetite, nausea, persistent diarrhea, headache, sore throat, weight loss, shortness of breath, mental status changes, muscle rash, and various opportunic infections. SARS is severe acute respiratory syndrome spread by person-to-person respiratory contact. It's accompanied by high fever, headache, and body aches. Can be caused by pneumonia and severe respiratory distress. All right. PPE for this should include surgical mask and eye protection, and put a mask on your patient. West Nile is mosquito-borne. Most infected patients have no symptoms or mild symptoms. Can develop severe symptoms that will last for weeks. Mild symptoms include fever, headache, body ache, nausea, vomiting, rash on the chest, stomach, or back, swollen lymph nodes in the neck. Severe symptoms include high fever, headache, confusion, disorientation, seizures, numbness, muscle weakness, paralysis, and loss of vision. Ebola is a viral hemorrhagic fever, normally found on an African continent, all right, but it has actually been found in the United States. There were cases several years ago about Ebola coming to the United States. The signs and symptoms of Ebola virus disease typically appear 2 to 21 days after exposure, with an average onset of 8 to 10 days. It is transmitted by exposure to the blood or body fluids of someone that has been infected. The key to transmission is contact with an exposed person or travel to the African continent where exposure may occur. As with all bloodborne pathogens, the use of standard precautions is essential. In many cases, specialized personal protective equipment requiring advanced training is also advised. Okay? Some of the symptoms of Ebola are severe headache, muscle pain, weakness, severe vomiting, all right, unexplained fever, unexplained severe hemorrhage. All right, the Zika virus. Zika is also spread by mosquitoes. It's rarely fatal but can cause birth defects to unborn children of infected mothers. There is no vaccination, and avoidance and prevention are key to limiting infection. All right, this virus actually comes from Africa and Asia. All right, it was prior to 2015. The virus came from Africa and Asia. The reason is not quite understood, but the viruses began to spread to previously uninfected regions, including Latin America and the Caribbean countries. Signs and symptoms include fever, rash, joint and muscle aches, headache, and conjunctivitis. Protection from Zika consists of avoiding mosquito bites where Zika has been found, avoiding sex with an infected or potentially infected partner, preventing pregnancy, and avoiding mosquito bites if already pregnant in areas where Zika has been found. We do have a vaccination for, we don't have a vaccination for Zika. However, most signs and symptoms can be treated with the administration of Tylenol or acetaminophen. All right, multi-drug resistant organisms. All right, these are like your MRSA, your VRE, your PRSP. All right. Your MRSA is methicillin resistant Staphylococcus aureus or vancomycin resistant, okay, penicillin resistant. It's common to patients who frequent the healthcare system because they've just been given all of these antibiotics over and over and over again. It can cause pneumonia, infections of the blood, ear, sinuses, skin, and peritonitis. You want to follow your standard precautions and avoid any additional instructions provided by the medical facility. All right, there's table 2.1 in your book. Okay, check these out. Mr. Bennett has not had a cough but has had a history of urinary tract infections that have led to similar signs and symptoms. Mr. Bennett's confusion is accompanied by some agitation. So Connor and Melinda speak calmly to him and but maintain alertness to the possibility that the agitation could lead to physical combativeness. Okay, the most common cause of agitation, altered mental status in elderly patients is a UTI. Okay, please remember that. All right, in addition to gloves, what PPE, if needed, if any, is needed. Okay? You think they're cool wearing just gloves? They need some eye protection. Alright. Protecting yourself from injury. Alright. Motor vehicle related incidents are the most common cause of EMS provider death, making it safe driving and the use of caution when working MVCs, motor vehicle collisions, some of the most important skills an EMT can develop. Alright. Please use your seatbelt. Use safe lifting and moving techniques. Get adequate sleep. Practice physical fitness and proper nutrition, and use your standard precautions. Other actions to protect yourself must be taken in the following situations. Rescue operations. We will not be training on how to do rescue operations. Alright? We will not be training on how to use the jaws of life. Stuff like that. We are not training on how to handle hazardous material incidents. Alright, we're going to get a little bit of training about violence and crime scenes, but however, that is a police matter. You let them handle it. And biological and chemical weapons of mass destruction. Alright, you need to make sure you are protecting yourself in these situations. Alright, for hazardous materials, you want to use the binoculars in the US DOT Emergency Response Guide. These should be located in every ambulance. Okay? Also, there is a response guidebook that you can download and put on your phone. Alright, you need to go ahead and request a hazardous materials team and allow the personnel to decontaminate patients and bring them to you. Alright, this is an example of hazardous material placards. Alright, this is your guidebook. It should be in every ambulance. Alright, we do not go over how to use scuba gear. Alright, self-contained breathing apparatus. If you're trained in that, congratulations. But however, we will not be learning how to do this in EMT school. Alright, typical hazardous material protective suits being donned and in use. Alright, we are not going to go over how to do this. Alright, every fire department, ambulance service are going to have different suits. They're going to show you how to don and get out of them. Okay. So, rescue situations. Some things you need to think about that may be potential hazards. Down power lines. Alright. Fire or threat of fire. Explosions. Hazardous material. Low oxygen environments. Okay. Alright. Down power lines pose a potential life threat for patients and rescuers. Okay. Alright. They are dangerous even if there is no fire or spark or evident. Alright? Federal law requires the use of high visibility apparel at or near roadways. High visibility vest or garments. You have Class 1, Class 2, and Class 3. Class 1 is designed for workers in parking lots and other areas with traffic flow moving less than 25 miles an hour. Class 2, designed for personnel whose attention is diverted from traffic or where traffic flow is moving at 25 miles per hour or greater. And Class 3 is designed for personnel whose work greatly diverts their attention away from the roadway and where they are at serious risk for hazards created by moving vehicles. Okay? I have these in my office. I make a bulk order every year. I can get you one. They're like $3 a piece. Not a big deal. Okay? You will have to have one of these when you go to clinicals. Alright, this is a picture of what they look like. Alright, violence and crime. Violence can arise from patients, bystanders, family members, or perpetrators of a crime. Do not ever enter an unsafe scene. Alright, scenes with high risk for violence are domestic disputes, patients or bystanders under the influence of drugs or alcohol, agitated, hostile patients, family members, bystanders, street or gang fights, bar fights, potential suicides, behavioral emergencies, and crime scenes. Okay? Alright. Picture A right here is a raid at a clandestine meth lab. Alright? And B is a warning note left by a victim of a chemical suicide. Alright, you need to be aware of what these things look like. Connor and Melinda complete their assessment and initial treatment of Mr. Bennett and prepare to place him on the stretcher for transport. All right, what are the potential risks to Connor and Melinda at this phase of the call? How can EMTs be proactive about minimizing these risks? All right, so they're in the middle of the call and they've already done their assessment. They're getting ready to move that patient over to the stretcher. This is where your body mechanics and safe lifting comes in. Okay, this is where you're really going to, if you're going to get hurt, this is the point of the call where it's going to happen. Okay, so wellness is more than just the absence of illness. It includes well-being in all aspects of living. The core component of physical fitness are cardiovascular endurance, muscle strength, endurance and flexibility, and body composition. All right, we need physical fitness, we need adequate sleep, and we need to learn how to prevent injuries. All right, so we talked about this. Cardiovascular endurance improves the ability of the heart, lungs, and blood vessels to supply the body with oxygen and nutrients. Activities include walking, jogging, swimming, or elliptical or stair machines. Reach and maintain your target heart rate for 30 to 40 minutes at least 3 times per week. Muscle strength required for the frequent heavy lifting that we do. All right, the ability of muscles to function over time without fatigue is known as muscle endurance. Okay, this is something that you will build up if you don't already have it. Muscle flexibility allows movement through the full range of motion without injury. And body composition, ratio of body fat to total weight. In EMS, we have a large problem, myself included, that we sit around, we eat fast food, we don't really do a whole lot of exercising. Okay, if you work a 12-hour shift, you know, running here and there, being in a car, ambulance, doing this, doing that. Man, when you come home, you want to relax in front of the TV, prop your feet up, drink a cold beer, and relax. You want to unplug, de-stress, all right? Going to the gym just ain't going to do that for me. I'm sorry. I wish it did. I wish I liked to run. I have friends that talk about this runner's high, and I just don't get it, okay? That I do not get a high from running. I may have a heart attack from running, but I don't get high from it, okay? So, the lower ratio of body fat decreases the risk of chronic illness. Well, I guess I'm just going to be ill, all right? One of the key factors to maintain as normal near function as possible is getting an adequate amount of sleep. This is something that I do not do. Lack of sleep or sleep deprivation puts you at risk for accidents and injuries. It also puts your patients at risk for improper care, resulting from your inability to function at the necessary mental and physical level. All right, individuals require a minimum of 8 to 10 hours of sleep each day. Studies have shown that a lack of regular sleep contributes to chronic diseases such as heart disease, weight gain, and poor mental function. See, I'm going to blame my weight on lack of sleep. It works for me, you know. All right. So, smoking cessation and alcohol and drug-related issues. Physical well-being includes stop smoking. Smoking is a risk to personal health and violation of your responsibility to promote public health. Anywho, alcohol and drug-related issues should also be avoided. All right, don't self-medicate. If you feel the need to self-medicate, find me, find one of the other instructors, find somebody in the fire department that you can talk to. All right. Mental well-being. Stress associated with EMS can affect your mental well-being. Over time, stress can lead to chronic physical illness and emotional issues. Okay? All right, Connor and Melinda transport Mr. Bennett to the emergency department, where they turn his care over to the nursing staff with verbal and written reports. The EMTs dispose of the gloves, wash their hands. Connor puts on a fresh pair of gloves and performs routine cleaning and disinfection of the ambulance and equipment. After their shift, Connor heads to the gym, while Melinda plans to read a book after taking a walk with her dog. Hopefully, she's not talking a walk with her dog. That's going to be a typo on my part. Taking a walk with her dog. After a good night's sleep, both EMTs return to work the next day, ready to meet any challenges that await them. All right, lesson summary. Y'all can read through these. All right, does anybody have any questions? Comments, concerns? Yep, going once, going twice, sold. Fantastic. On to chapter 3.